Good afternoon, and thank you for being here or for tuning in, wherever you are. Yesterday, I announced that we believe that we're seeing early signs that the mitigation efforts are starting to pay off. And I don't want anybody to misunderstand what I said yesterday or what I'm saying today. We are seeing early signs that the curve is starting to flatten. But what this means is we have to continue to do those things that have caused the curve to flatten, that have caused the slowing of the spread of this virus and this disease. And that's the mitigation measures, the stay-at-home order, getting out only when absolutely necessary, and doing those things that are essential and not doing essential things every day. And when you do, practice social distancing. And now you're being encouraged to wear a mask when you have to get out and in close proximity to other people. Making sure you're following all the hygiene measures that we've been talking about all along, such as controlling your cough, such as washing your hands frequently with soap and water for 20 seconds, for using hand sanitizer, staying 6 feet away from people, and so forth. Now, we still cannot say with absolute confidence that the curve is flattening, but we are still seeing more evidence that we are moving in that direction. I would also remind people that our modeling and national modeling, and I know that everybody's paying attention to this these days, they are showing that we believe we're improving what the outcome is going to be. But all of that modeling is premised upon the assumption that we continue to effectively do the mitigation. And so if you want our numbers to spike, and I promise you they will, all we have to do is stop paying attention to, stop complying with the mitigation measures, and we're going to see our numbers spike right back up to where they were. And so it's really essential that the people of Louisiana hear this message and understand that just because we think we're starting to flatten the curve doesn't mean our job is over. And in fact, now is the time to double down. This is still going to be a very difficult week, and next week is going to be difficult, and I'm going to go over those numbers here in just a second. But I do want to tell the people of Louisiana, I appreciate those who are complying, and I think that we're getting more compliance over time, not less. We still know there are a lot of people and some regions of our state that, quite frankly, aren't doing as well as they should, and I'm encouraging them to do better and understand that this is a statewide problem, and there'll be some more information that will establish that pretty conclusively here in just a second. So as of noon today, we reported 1,417 new cases. So we now have 16,284 cases across the state. And I want to remind you all that every time we talk about a number, whether it's that number I just went over, 1,417 new cases or over 16,000 cases, we're always talking about our fellow Louisianans. These are human beings. These are our brothers and our sisters and so forth. And that should never be lost on any of us. Unfortunately, we are reporting today 70 new deaths. That is the highest number we have reported at any time in a 24-hour report. And remember, we're not saying that 70 people died in the last 24 hours, but that is the report that we have today, is that 70 new deaths have been attributed to COVID-19. Some of these people expired, and many of them, perhaps most of them, expired before yesterday, but the report just came in today because the testing finally confirmed that the individual had COVID-19. 519 patients are currently on ventilators. That's a big number, but it's actually a decrease yesterday from 552 patients. And what this reflects, we believe, is improvements in the way we are dispensing medical care in Louisiana and achieving better results with fewer people having to be placed on vents and people being able to come off vents a little earlier than we originally thought would be the case. And so I want to, again, thank the medical community out there, all those doctors, all those nurses, all the respiratory therapists, and everybody else associated with delivering health care in Louisiana currently under these very difficult conditions. And while the number of patients on vents went down, the number of patients in the hospital actually went up. We currently have 1,996 patients hospitalized across the state with COVID-19, and a number of others who are still under investigation. And I think that number is about 990 that are under investigation. In fact, you can see it there. They are in the hospital, and a large percentage of those are ultimately going to prove to be positive for COVID-19. I do want to make a correction regarding the number of hospitalizations we announced yesterday. There was a data reporting error, and the number of patients hospitalized yesterday was actually 1,981, and we reported a different number than that, and I apologize. We're taking steps to make sure that that does not happen again, because we are trying to be transparent, we're trying to be timely, and we're trying to be accurate. I mentioned yesterday that, and in fact this is the source of a lot of national news reporting right now, not just in Louisiana but around the country. We know that just over 70% of the COVID-19 related deaths in Louisiana are deaths of African Americans, while they make up 32 to 33% of our population. We are looking into this further and trying to figure out everything we can about that. For example, what percentage of overall cases do we think African Americans make up? What is the role of comorbidities in these deaths, and so forth? And we have a lot more questions than we have answers at this time. I believe yesterday we may have been the first state to report on this, and we're trying to get more information, not less, and as soon as we have more, we're going to share that with you. We know that there are now confirmed cases in 63 of our 60. We added Cameron Parish today. Tensas is a confirmed positive case of COVID-19, but I can assure you it is in Tensas Parish, just as it is in every parish and every community. The virus and the disease is out there. This is public health emergency and cooperation all across the state of Louisiana. One of the bright spots in this is testing in Louisiana to a degree frankly no other state has done. According to the information we have, we're now #1 in the country in per capita testing. And I think that speaks volumes to the efforts that we have underway, led by the team at the Department of Health and Office of Public Health, and of course Dr. Alex B. has been here with us every time that we've had one of these press conferences, and he's working hard every single day with his team. But I did want to point that out. And by the way, I don't say that because we're satisfied. We're not. We want a lot more testing, and we want a lot more testing in rural areas especially. We know we need more testing in the river parishes, and we're moving in that direction as well, and you may have some more questions about that. But I did want to point out that we have now administered more tests in the state of Louisiana per capita than anywhere else in the country. In fact, we're right at 75,000 tests now. A bright spot has also been the incredible report that we have received from businesses, neighbors, and nonprofits. To date, all 64 parishes have received PPE, and 126 medical facilities statewide have received supplies. I specifically want to thank Apple today and AmeriCorps for sending masks to our state. As promised by Tim Cook, the CEO of Apple, we received 400,000 masks last night and are in the process of distributing them. AmeriCorps transferred to us about 14,000 N95 masks this week as well. We are grateful for all the help that we are receiving, and we thank everyone for their generosity. We want to support our businesses as much as possible. One way that you can do this is buying locally, and I joined Wildlife and Fisheries Secretary Jack Montase and encourage everyone who's going to go out and buy seafood, purchase seafood that was caught in Louisiana by Louisiana fishermen, or packaged here and produced here, and that sort of thing. The state's fishing industry is still reeling from last year, which was particularly tough with the multiple openings of the Bonacary spillway and the floodwaters that put too much fresh water in certain areas of the state. So when you go out and purchase food, please think about spending a few dollars on seafood caught and produced here in Louisiana. Every dollar helps. And if you want to find out where you can purchase local seafood, you can go to louisianadirectseafood.com. louisianadirectseafood.com. From there, you can arrange local pickup, or you can have it shipped to your home. And before I take questions from the press, we're going to start something a little bit new today. We have a lot of people who are staying at home, and they have questions for me that, quite frankly, you're not asking. So we're going to start taking a few of their questions, and we're going to start today with taking two. So if members of the public, if you have questions that you want asked, please submit your questions to askjbe@la.gov. askjbe@la.gov, and we will get to some of those at future press conferences or on social media. We'll try to respond to as many as we can. Today we have two questions that we're going to entertain. The first is from Maggie. Maggie is from New Orleans, and she asks, if so many people who are positive or asymptomatic, why are we limiting testing to only those with symptoms? Isn't it important to identify all positives so that they don't spread the virus unknowingly? It is absolutely essential that people don't spread the virus, whether they know they're positive or not. But the fact of the matter is, and I confirmed this again with Dr. Bu this morning, the tests are not designed to give a reliable result for someone who is asymptomatic. And so someone who is asymptomatic may actually have the disease, may be shedding and transmitting the virus, but the test is going to potentially come back negative, giving that individual a false sense of security, so that rather than engaging in the mitigation measures, he or she would be more likely to go out and start interacting with people again. And so that's why we don't do it. And while we have those 75,000 or so tests we've already done, we haven't done as much as we need. And we have priorities that we're trying to focus on, folks like first responders, people in the medical community, people who are in our hospital, so that if they don't have the virus, we don't have to burn as much PPE and caring for them and all those sort of things. So that's why we're not administering tests to people who are asymptomatic. But as Dr. Fauci said a long time ago, everybody should behave as if they believe they have it and that the person closest to them has it. And if we'll do that and follow all the mitigation measures, we're all going to be in much better place. Secondly, Palmer from Baton Rouge asks, what is your advice for small business owners who live paycheck to paycheck and can't afford to pay employees for 2 weeks or even take out a loan? First of all, I encourage all small business owners like Palmer to apply for the Paycheck Protection Program and do it today if you haven't already done so. It's imperative that you do this now because there are $349 billion available. I saw just a moment ago a report that says $60 billion has already been allocated. So about a fifth or a sixth of the program is already accounted for in terms of the dollars being allocated. Possible. Financial institutions across the state of Louisiana are still working to access these dollars, but time is of the essence. The program is available through the Small Business Administration, and you can also apply for direct assistance by visiting sba.gov, sba.gov. And I also recently announced that we have a new program here in Louisiana called the Louisiana Loan Portfolio Guarantee Program, which will offer loans of up to $100,000 to Louisiana small businesses of fewer than 100 employees who were impacted by the COVID-19 crisis. The loans will require no payments and will accrue no interest for the first 180 days and carry below market interest rates of no more than 3.5% thereafter. The loans will help businesses impacted by this public health emergency to meet their payroll, retain employees, pay rent, mortgages, and so forth, keep the lights on, and hopefully the doors open. And you can apply at opportunitylouisiana.com/loan. opportunitylouisiana.com/COVID-19. That's opportunitylouisiana.com/COVID-19. And with that, I will take your questions. Greg.
Governor, yesterday you said your great fear was in letting people know some good news and striking an optimistic tone that you would see people reverting back. I saw a story on today that said that for the first time after Como said something similar, that they saw tons of people out in New York City. So is that something that you actually...
I have not. Concerned? I have not. In fact, I haven't even been given reports about that. But it is a concern that I have because we want to message, we want to communicate with the people of Louisiana and be as accurate, as factual as we can be. And as soon as we started seeing numbers that indicated that we might be flattening the curve, I needed to tell them that because that's different than what we were saying over the previous weeks. But what it really means is our mitigation measures are starting to work and to show up in the numbers. And the exact wrong thing to do is to stop the mitigation measures. And if you've seen, and so we don't want that to happen. Yes, sir.
Governor, can you talk more about why we're seeing a drop in the number of people on ventilators? You mentioned hospitals are getting people off of ventilators more than you thought they would, and people are staying on as long.
And if that's done later. And so I'm going to let Dr. Bu come in our hospitals because he can confuse you with all the medical.
I'll try not to confuse. I think what we're seeing, they're working to keep people off the ventilator, as the governor said. There are certain conditions for which you want to get somebody on the ventilator early as possible, and it shows that they do well. What we've learned from COVID patients is that COVID patients don't do as well if we push them on the ventilator early. So the idea is to use things like non-invasive methods, things you might have heard of in the press, like BiPAP. Use those earlier. He does need that level of care and is on a ventilator, using the best evidence to understand how we can limit the time that person spends on a ventilator. And we've got real clinical leaders, national clinical leaders, in places like New Orleans and Baton Rouge. For up to 72 hours afterwards, we're seeing test results. What we don't know is if that virus itself is still able to infect people. Because remember, the way that we test for the virus really just looks for that trace nucleic acid. And that could be there and just not actually together in a format that it can actually infect somebody else. So we'll be looking to our researchers to tell us a little bit more of that information.
Doctor, can you tell us why there's such a disparity between the number of tests given for East Baton Rouge and Orleans Parish? We have about 5,000 tests here and 20,000 in Orleans. They have about 5,000 positives. We have 1. So it would appear like the ratio could almost be the same, but why are there so many more testing done in Orleans Parish?
Well, so Orleans, unfortunately, was at the forefront of this outbreak. So they've been testing longer, and you have to keep that in mind, that they had a couple of weeks ahead. Also, that's where we've put, because of the level of COVID, we've put a lot of resources to ensure that we're adequately testing, like the FEMA sites that we have from the federal government. We have 2 that were consolidated in Orleans Parish, 1 that's in Jefferson Parish, and then we just have more hospital resources, more healthcare resources in the greater New Orleans area as well, more hospitals that are doing in-house testing. What I will say, though, going forward is we are looking to see all of the communities, as the governor said, really rural parishes have more access to that testing, looking how do we reallocate resources, not just state resources, but also private labs, and foster their development so that they can serve the needs of those communities, because we really want to make sure that wherever COVID is, we are seeing it, identifying it, isolating it, reducing the spread.
But is there a way to ramp up faster here in the capital city?
Well, I mean, I think certainly we're looking at ways to address the bottleneck in the specimen collection kits. So you might have heard that there's a challenge nationally in those swabs that go in the nose. We're looking at alternative swab types and being able to use those. That would be something that would certainly increase not just the capital area, but statewide, the ability to test more.
Doctor?
Yes, sir.
So one of the biggest fears for people who think they may get it are that they'll die without a ventilator, and for a while we were putting dates where Louisiana might exceed its capacity. Is that date no longer in place? Not that it couldn't be, but I mean, are there now enough ventilators to?
So as the governor, I think it answers this question, very well. there are so many factors that change on that sort of date. There's the ventilators that we've been successful in bringing into the state, both from manufacturers and the Strategic National Stockpile. There's the work that I just talked about with our providers being able to make more of the ventilators that we do have. And then there's the work that all of you are doing in staying at home, in socially distancing, in washing your hands, in not going to visit with your neighbors closer than 6 feet. All of those things move where we think that we would be in the need of projectors further and further down. And so we continue to gather that information, look at it on a daily basis, and give advice to the governor on where we think those numbers are. And we continue to see that they do move out. Again, that's because we're doing all of those things. And the governor makes the point very well that if we start to relax any of those efforts, we wouldn't want to be in a position where suddenly now we need all those ventilators that we're grateful not to need, in the next coming days.
But on that point, I know the modeling is like for, a week to 2 weeks out as
That's
the
right.
point for beds and ventilators. Are we no longer seeing in that 2-week trajectory that we're expected to run out of either of those things in the New Orleans area? Do things look that good at this point?
So again, you also have to keep in mind that what we see in case counts and even in death counts is behind when the actual actions that change those numbers took place, right? So we're still seeing now the effects of 2 weeks ago behavior. Some of the stuff that I talked about with hospitals, that's stuff that changes more quickly, how well we manage our patients. So right now, we're seeing that this trend is promising. We're not yet ready to say that we're moving to a different level of infection from an individual. Or in other words, we're not able to conclusively say we think that we need to move that number further than we have already. So right now, we're not making that recommendation.